All right. Hi, everybody. Happy Wednesday. I'm going to hang on just for a second to get everyone that is able to join us live so that you have the opportunity to join us. I have a special guest here with me today, Stacie. I'll introduce her here in a second, but we are going to be talking about cholesterol, and that seems to be somewhat of a controversial topic depending on who you ask. There's lots of different opinions, and unfortunately I feel like we've been brainwashed in the past with these low-fat diets and things that we have deemed as healthy. So I want today to kind of chat through what is important about cholesterol, the myths that we can debunk for you in regards to cholesterol, and give you the facts. So what is the deal with cholesterol, and is it really fat, dietary fat, that's causing our numbers to rise? And have you had a doctor recommend a low-fat diet? Is that really helpful? So I know those are some questions that you probably ask yourself whenever you are thinking in terms of cholesterol. If you've had some, labs come back and say you have high cholesterol. And also along those lines, just looking at total cholesterol isn't enough to really determine or get the full picture of your heart health. Research now is saying that by simply reducing your fat intake isn't necessarily going to improve your numbers. And really, there's a lot of research out there now that says there isn't a link between the total fat intake, or saturated fat especially, and dietary cholesterol in regards to heart disease. So we're going to talk all about that. And also, just considering the fact that if fat was really the main cause of our increase in heart disease, the fact that we now consume at least 25% less fat than we did in the 80s, you should see a reduction in heart disease, and that's actually not the case at all. We've seen an increase. So that makes you pause and think, is low fat really the way to go? And we know now that it's really not the amount of fat that we're eating, it's the type of fat that matters most. So I have my friend and registered dietitian here with me today, Stacie Haaga. She is going to help me and help us answer some of your burning questions about cholesterol and just kind of set the facts straight for you guys. So Stacie, thank you so much for being here. I appreciate you so very much taking time to educate us on cholesterol. I have so many questions for you, and I know those listening here do too. If you are listening, I would love for you guys to share in the comments below. Are you team yolk or team no yolk? I know that Stacie and I were chatting about eggs and how there's just a very negative connotation around eating eggs. So are you team egg or team no egg? So we'll talk about that too here in a second. But first of all, Stacie, could you just kind of chat through what cholesterol is in general and what that does for our bodies?
Yeah, absolutely. Well, thank you, Lauren, for having me today. And I'm excited to talk about this topic because it does affect, men, women. I mean, we've seen even children anymore going on statin drugs and, being diagnosed with high cholesterol. So I enjoy talking about this and shedding a little bit of light on cholesterol. And I want to just preface our conversation by saying I'm not a cardiologist. I'm not a physician, so I can't diagnose people with high cholesterol or, heart disease. That's not my job. But I do, as a functional dietitian, see a lot of clients who come to me, who are referred to me from doctors often for heart healthy diet advice, and people who want to improve their markers for heart health. So that's really where I come from as a functional dietitian. But, the issue with cholesterol is that it's not actually a bad thing. We have demonized cholesterol over the years, and really it's not that bad. Our bodies actually produce about 80% of our total cholesterol. Our bodies will produce the cholesterol that we need. It uses fat, carbohydrates, and protein in order to produce cholesterol. And only about 15 to 20% actually comes from food, which is why I'm team yolk, which is why I say eat the yolks, eat the whole egg. Yeah. But really, dietary cholesterol actually has little bearing on our cholesterol numbers. What's more is that we actually really need cholesterol. It's part of every single cell in our body. So, think about that. We actually need it. And we're so focused on let's decrease our cholesterol all the time. So it's actually a critical building block for our cells. It helps us produce hormones. You guys, I'm talking about estrogen and testosterone, these things that we need. It is critical for vitamin D synthesis. And if you are following me on social media, I probably talk about vitamin D at least once a week because it's so important and so critical to our health. So we're really looking at cholesterol the wrong way, and we need to appreciate the fact that it is doing so much in our body. And one last thing I forgot to mention, ironically, it actually helps to boost your memory, and it boosts serotonin, which is that happy hormone. So.
That's awesome. Okay, so now we know what cholesterol is and why we need it. What is the problem? When does cholesterol actually become a problem for us?
So with all of that said, obviously cholesterol itself isn't necessarily the problem unless there's inflammation. Inflammation is at the root of so many of our chronic diseases right now. So when we have that inflammation, we end up having issues. And there's different types of lipid particles, right? There are kinds of lipids that, you've heard of, good cholesterol and bad cholesterol. Well, one of the LDLs is actually a light, fluffy cholesterol that's really good. Now, the little bullet-like VLDL, which is very dense and small, that is a higher risk LDL, okay? And that's because it's more likely to become oxidized. And that's the problem, is when we have oxidized cholesterol, we have oxidized fats, and we have inflammation. Triggers of oxidation are going to be poor diet and overall inflammation. Bad fats or unhealthy fats will trigger that inflammation and the oxidation, whereas our healthy fats actually help us produce that HDL, which is that good cholesterol. So when you have this perfect storm of not enough good fats, so you have low HDL, and you have too many bad fats, which produces that bullet-like VLDL, your body sort of, as a mode of coping with that, it'll produce a plaque in your arteries. And that's where we have a problem, right? And over time of that with that buildup and that inflammation in our arteries, it tightens up. And that's really the problem, is our diet and overall inflammation.
Awesome. That's so good to know. Okay, so this is another thing that I think people are very unclear on. Does high cholesterol put you at risk for heart disease?
So, just looking at cholesterol alone, it doesn't really correlate well with heart disease. We cannot just take those numbers and say you are at greater risk. We've made some big conclusions about cholesterol and the role that it plays over the years. What we really need to look at is, do we have high blood pressure? Do we have obesity? Do we have excess body fat around the waist? Do we have more of those small, dense particles or more of those large, fluffy particles? And then probably the biggest thing that I look at when someone comes to me with their lipid panel is, what are your triglycerides doing? Because triglycerides really do correspond with the heart disease and greater incidence of heart attack and stroke, up to 4 times greater. And triglycerides are so much determined by your diet. In fact, the way I explain it to most people is that triglycerides indicate you have too much sugar in your diet and you are basically sugar intolerant. Okay, so we know we can do a lot to minimize those triglycerides with diet, whereas if we're feeding our body the right healthy fats and we're keeping low sugar, your total cholesterol really doesn't have a large bearing on your overall heart health.
That's so good to know. Awesome. Okay, so tell us now, how do you know what a healthy cholesterol level is? How do you read your labs to know what these numbers mean? Can you break that down a little bit for us?
Yeah, absolutely. So I think, again, not being a physician, I would never be the person to diagnose you with high cholesterol or to make any, write you a prescription or anything like that. But I think it's so important that we are our own best advocates and that we are the primary determinant of what our healthcare is and how we address our overall heart health. And so you need to know how to read your lipids panels. Just having your doctor tell you that you have high cholesterol isn't enough. Okay. So when we look at your total cholesterol is going to be probably between 200 and 250. I'm seeing more doctors, thankfully, hold off on treatment until you're over 250, which is good, because if you have high HDL, that's that good cholesterol, that's going to make your total cholesterol higher, right? Mm-hmm. So we want that high, that HDL. HDL needs to be between like 50 and 90. Below 50 is a problem. Above 90 can also indicate some issues. So I normally like to keep it, with that, the higher you go is not always better, but I don't often see that. For LDL, I would recommend keeping it under 130. That's really where you want, that's a fine area. That VLDL, again, that small particle, you're looking at a really big range on what is normal, but I would recommend around 10 to 14 on your labs. And then your triglycerides, again, we've got to get those triglycerides down to under 100. And that has a larger threshold for a lot of doctors too. And I've seen people up around 300 or even 400. And some of that can be genetic, but we can do a lot to turn off and on our genes through diet and exercise and taking care of ourselves. So that's kind of the basic lipid panel. But honestly, again, when I'm looking at risk, probably the biggest indicators for risk would be, what is your triglyceride to HDL ratio? You want to have a lower ratio there. So that can be an indication of, of heart disease. And so we want to make sure that we keep that in check. And that's really where we want to look.
Okay, so what are the levels that ratio should be at, or what is good and what is bad?
Okay, so it should be below 2. Okay. So let's say your HDL is 60. Ideally, your triglycerides should be 60, right? So your 60 to 60 would be a 1-to-1 ratio. Mm-hmm. So under 2 would be optimal. 4 is considered high. 6 is very high. So again, we want to have that good HDL, but we want to keep those triglycerides low, under 100. Both should ideally be under 100.
Okay, that's really good to know. I hope you guys are taking notes.
That's a lot.
Now let's get into what can be done to either lower your cholesterol, or even what we can do to prevent elevated cholesterol. What are some of the options for treatment? First of all, let's talk about that.
Yeah, well, the conventional treatment, the conventional therapy, working with your physician, most physicians are going to push statins because, we know that they can reduce cholesterol. And again, 200 is the threshold that most physicians are looking at. Now, again, I'm seeing more physicians out there who are saying, okay, we can go a little bit higher with cholesterol. So maybe they're going to give you more time to work on diet and exercise, and maybe wait, until you're over 250 if that happens. Unfortunately, I've had a number of people in my practice who've come to me who really can't take statins because of the side effects that statins have. And we really underappreciate those side effects, but they do come with a risk. And I'm not sure that the risk is enough to outweigh, I mean, I don't think the benefits are enough to outweigh the risk. They really only reduce the risk of a heart attack or stroke by like 3 or 4%. So in some studies, there's not much difference between the placebo and the statins. So you really have to know what you're getting into when you take a statin, because it can increase your risk of type 2 diabetes. And that's a big deal, especially in postmenopausal women. And I know that there are a lot of you out there. So, that's something to keep in mind. Memory loss, I mentioned that earlier. Oftentimes when you get under 150 on your total cholesterol, you will see memory loss and sometimes early dementia, and that's real, and that comes along with statins. So I know that that's a real issue, but I've also seen nerve damage in the hands and feet. I've seen just joint aches and pains, lack of sex drive, and decreased benefits of exercise, or even impairing exercise to the point where you're so sore that you can't really exercise.
Wow, that's really eye-opening. So thank you for sharing that. There's a lot of things I didn't realize about that. Okay, so well then let's talk about what we can do to reduce our risk of heart disease without maybe needing those medications, or what we can do to prevent.
Well, this is where you and I come in really in what we do. Obviously talking about nutrition and exercise. I can tell you that whatever we've been doing for the last 50 years is not working, because the recommendations that have been made have actually put us in a worse position. Heart disease is one of the top chronic diseases that we face. So, we moved into this low fat, high carb, recommendations for a heart healthy diet. And now all we're seeing is heart disease. So all we did was fuel the fire, right? When we took out good fats, we went to those Franken foods, we went into margarine and seed oils. And really, these are unstable fats, which are going to trigger that oxidation I mentioned earlier. And that is a problem. They're going to cause more inflammation. So those healthy fats are the ones that are going to help us, but we've been avoiding those. And then likewise, a lot of these foods that are low fat have added sugar in order to make them palatable and make us want to buy them. And so now we're just eating sugar and unstable rancid fats.
Right.
And we're expecting to feel better, and we're not, right? Yeah. So all we've seen is that they actually trigger more heart disease. So I guess we could get into, what do you do? What does that look like then? So what our bottom line is, we have to reduce the inflammation in order to manage our cholesterol.
Okay,
so
do that. Give us
I think one of the biggest issues is really just managing our sugar intake primarily, right? So managing glucose tolerance, reducing insulin, reducing our insulin production, but also making us more sensitive to insulin. So just a quick primer on what insulin is. That is a fat storage hormone. Basically, you produce insulin in response to sugar and carbohydrates. Your body produces insulin to push down your blood sugar. Well, insulin's a fat storage hormone. So if you're doing that all day and all night, your body's just getting the signal you need to hang on to fat. And meanwhile, that is also causing that fat oxidation that we're talking about. So we need to minimize the insulin through fasting. Intermittent fasting is a great way to do that. For 16 hours, we're not producing insulin. And then making sure we're eating those healthy carbs with lots of fiber and antioxidants. Those are key. So getting your fruits and vegetables and whole grains is absolutely so important. when it comes to choosing your carbohydrates. And then, when it comes to your fats, we're talking about naturally occurring healthy fats, like including saturated fat. We're talking about avocado, olive oil, coconut, nuts and seeds and meats. Those are the fats that we really want to focus on.
Right. And so if you guys are not hearing what Stacie is really saying, she's saying that fat is not the culprit in heart disease. It's sugar that has the higher response, or is the bigger trigger. And saturated fats are not bad for you, except for when they are paired with sugar. So a Snickers bar.
Yes.
For example, refined carbs and sugar paired with fat, we'll call that sugar fat. And that is what raises our insulin and causes that fat storage and also the inflammation, which then goes back and leads us to our point that we made in the beginning, that inflammation is what drives our cholesterol up, right? So there's
absolutely,
there's other things that we can do to maybe reduce risk factors through losing weight, exercise. Talk a little bit about that.
Yeah, absolutely. Well, I mean, obviously, I mentioned earlier that, cholesterol can be an issue if you have certain kinds of lipids, but also if you have those other risk factors of what we call metabolic syndrome. Metabolic syndrome is that impaired glucose regulation, where we're not sensitive to that insulin, so we're overproducing insulin to regulate our blood sugar. If we have high blood pressure, if we have a larger waist circumference, exercise will actually increase your HDL, which again is that good cholesterol. Saturated fats and healthy fats are going to help you increase your HDL. Vegetables will help you increase your HDL. So there's a lot that we can do. Those things are also going to help us maintain a healthy weight, right? They're going to help us maintain a healthy weight and reduce that waist circumference size. So we have a lot of things that we can do that are in our control that don't necessarily require a statin. The other thing I would mention is alcohol. Alcohol has a huge impact on your triglycerides, for one, because again, alcohol is basically just sugar, straight sugar to your bloodstream. So not only is it going to cause inflammation, it's also a contributor to high blood pressure. It makes it difficult to manage your blood sugar, and it causes damage to the liver, which is where we actually produce that necessary cholesterol. So I can't emphasize that enough, that alcohol and those unhealthy fats and sugar are going to be the main drivers of any heart disease issues that you might have.
Right. That's so interesting. Okay, so you mentioned eating those complex carbohydrates, especially fruits and vegetables, starchy vegetables, eat them all day long in unlimited amounts, honestly, because those are the good carbohydrates, right, that are rich in fiber. They help to reduce the absorption of fat and sugar in the small intestines, and that reduces overall triglycerides. We also talked about how low fat intake can actually lower your HDL, right?
Yep.
Did we hear that? So that's not what we want. But remind us again, what types of fats do we need to avoid? Maybe give us some examples of those refined, hydrogenated, processed fats that we need to stay away from.
Well, I mean, we've heard a lot about trans fats over the years. Some areas have banned trans fats. Now they need to be on the label. So certainly if you're eating anything with a label, which I don't recommend a lot with the labels. So that's your first step is, avoid anything with a label, and you're going to avoid a lot of these unhealthy fats. But trans fats are like bad fats gone worse, where they've been so chemically manipulated that they're very unstable in the body. So baked processed goods, a lot of those snacky kind of treats are going to have trans fat, but also your margarine, I can't believe it's not butter, your Smart Balance, all of those are just not where you need to be. That is not what you need to be eating, because they just don't offer the same benefits as olive oil and avocado oil and your nuts and your seeds. Those are going to give you those mono and polyunsaturated fats. And then your naturally saturated fats like butter and coconut oil are great options for heart health. Believe it or not, we've been avoiding those, but we do need to include some of those in our diet.
Yes, exactly. 110% agree with you. What do you think about sleep or gut health? Are there ways that we can improve those areas of our life to actually help reduce our risk for heart disease?
Absolutely. I mean, this all comes back to inflammation. And when we think about inflammation, that's going to start in the gut, which is like a whole nother topic. Gut health is a passion of mine. But talking about those starchy foods, those are going to feed the healthy gut bacteria that we need. So we need to absolutely focus on gut health, make sure that we are taking care of things there. We're eating lots of great bacteria, maybe even taking a probiotic. Saccharomyces boulardii is one that has been indicated for helping to manage cholesterol, but also it's been indicated for weight loss in different trials. So I really like S. boulardii, especially if you have like a yeast issue going on, which a lot of people do. And then certainly sleep is another component of managing inflammation, sleep and stress management. Your health is like a tabletop. I always tell people you've got 4 legs. You've got exercise, you have diet, you have stress management and sleep. And if one of those legs is shorter than the other, you're going to be imbalanced. So, definitely making sure you're getting good quality sleep is important for managing these inflammatory markers that put you at higher risk for heart disease.
That is so good to know. Okay, Stacie, thank you so much. This was so helpful. I know that everyone listening really appreciates you. I think there are a couple of questions here, and I would be happy to. We'll answer those. Stacie will.
Sure.
What are your thoughts on a plant-based whole foods diet versus, I guess, a meat-based diet? I guess is what she's asking.
So I would say I don't necessarily promote a vegan diet. I have clients who are vegans, and I know that they have to work very hard to get the amount of protein that they need. But, some of them do it very well and can manage that. But there are certain nutrient deficiencies that can happen when you leave out animal protein. And I think that there are a lot of health benefits to animal protein, and not enough indication to me that there's an issue related to heart health and cholesterol. I don't see those as being an issue with heart disease because of all the reasons we just talked about. Healthy fats, making sure we're eating lots of fiber to help pull out any kind of oxidized fats to help us, maintain happy and healthy bowel movements. There's a lot of benefits. I like to do half a plate of vegetables, but I still like to have the animal protein in there if you are willing to eat it.
Good to know. Good to know. What about this one? Would you recommend Everlywell testing from home?
For cholesterol, I'm assuming. I don't have a lot of experience with Everlywell. Now, I use different, I do a lot of food sensitivity testing. So I use a different test for that called MRT. And I primarily know Everlywell for their food sensitivity testing. For getting, lipids run or just doing a basic metabolic panel, obviously you can work with your physician on that. Most of that should be covered. If you need an advanced lipid panel to tell you about the particle size, then I would ask your doctor. Again, this is just something you need to have a conversation with your doctor about. Like, I want this advanced panel. But there's also something called Direct Labs, which is run through Quest Diagnostics. And you can order any labs. As a patient, you can order your own labs and go and get your blood drawn and do that. The problem is your doctor can't give you a diagnosis unless he has the labs. So then at some point you may have to go to the doctor and say, here's the labs I've run. it's really up to you, but you can use direct labs.
Awesome. So good to know. Okay. And then lastly, we've already covered this, I believe, but her question was, how do you raise a low HDL? So we talked a little bit about that already. So I think we're good there. All right. Well, thank you so much, Stacie, for being here. This was such a great conversation. I think it was so helpful. Tell us where everyone listening can follow you, because they will learn a tremendous amount about nutrition through you. So tell us where we can find you.
Well, I'm on Instagram and I'm on Facebook. I have a website. My handle is Stacie H Nutrition, Stacie with an IE. And you can find me at staciehnutrition.com, which is my website. And so, yeah, go ahead and you can find me there with all kinds of tips.
Awesome. Thank you again. And if you all enjoyed this video and found it valuable, please feel free to hit that share button, share it with your friends and family so they can learn a little bit about cholesterol too. Stacie, thanks for being here. I hope everyone has a great day, and you guys have a wonderful day. See ya.
Bye.